everyone. This is Chadi Alraies from NCVH 2025 in New Orleans. I'm privileged to be with Frank Tursi to talk about a new session that is developed this year in 2025 about regenerative medicine. Frank, thanks for being with us.
Thank you so much.
Yeah. So tell us about this interesting.
So about a year ago, I was asked to speak at NCVH in Nashville. And in the process of that, I was asked to give a talk on regenerative measures and regenerative medicine techniques in cardiovascular care. It was really new to me. I'm a foot and ankle specialist, and the Dr. Osama Ibrahim had asked me to give that talk, and I said, Osama, I'm a foot and ankle guy to speak about regenerative measures in cardiovascular care. I'm happy to do it. He said, well, you know more than most people we know about regenerative medicine, and I'd like you to do some research. And I did, and found that the institutions in the past that were really kind of reluctant to support it, they said there wasn't enough peer-reviewed data and so on and so forth, are now embracing the world of regenerative medicine. In fact, they're opening up stem cell institutes, institutes for regenerative medicine, and these are the top institutions in the world. Mm-hmm. So that was very exciting to me because I've been doing regenerative medicine now for almost 20 years. And I offer in my clinics, I have platelet-rich plasma therapy, I do something called bone marrow or adipose-derived stem cell therapy. We do some prolotherapy, we do some amniotic tissue grafting or amniotic tissue injections, and we do umbilical cord product injections. These are the latest and the greatest methods of boosting the regenerative healing process. So if you get an ankle sprain, your body gets inflamed from that sprain, but rarely that inflammation, it's initiating healing, rarely does it last long enough to complete healing. So it kind of goes to sleep. You start thinking about your sore shoulder or your neck and your body shuts down. We actually turn around and we wake it up.
Reboot the process.
Exactly. Numb a patient up, we draw their blood if it's PRP, we spin it down in a centrifuge, it separates out platelet and rich plasma. I take it in a syringe and I inject it into the area of inflammation where they've been injured. And it creates an initial inflammatory response which resets the healing process. And then it ends up kind of starting to subside. So it's real important that patients don't take anti-inflammatory measures while they're kind of in that 2-week zone of the injection. They're also welcome to pretty much do whatever they need to do during the recovery. There's no real downtime. The stem cell type therapy, where you're getting true stem cells from either visceral fat, which is the fat around the organs in the belly, or bone marrow, that has true stem cells that can morph into the cells that you need them to do. Yeah. So if you have an injured heart, which is what they're looking at doing now, you'll take cardiac or cardiomyocytes and injecting stem cells in so you can reproduce the heart cells itself.
So the affected area can re-heal and recover.
Yes.
So this has been going on for, you said, 20 years doing this.
Yes.
And this is related to any injury. Is it musculoskeletal? Now you said cardiovascular as well. Is it also wound healing? Would you use that as wound healing?
Yes, it is. So 100 years ago, they started working with burn victims. So if somebody got a bad burn and they went into the emergency room, they would take them down to the maternity ward, and whoever had a baby, they would take the placenta that was delivered during the pregnancy, they'd take the placenta and they would lay it on the burn. And they didn't do any tissue screening or typing or anything, but they found patients were healing in much quicker times, less risk of scar tissue, less risk of infection. So then it spun into using it for eye surgery and then spine. Sports medicine-wise, my field, we really started about 20 to 25 years ago, and I started right then. I worked for a professional sports team, and our objective was really to safely get the players back as quickly as possible. Yeah. And we did.
Absolutely.
Through this.
Yeah. Well, I mean, really very interesting topic and session at NCVH. I think this is eye-opening, but also I think it's good therapy and option for patients who are, as you said, healing and expedite recovery. Frank, thanks again for your session and for a great interview, and watch the videos and others on the YouTube channel. This is Chadi Alraies coming to you from NCVH 2025 in New Orleans. Frank, thanks again.
The pleasure is always mine.
Thank you.
Thank you.